Diabetes is a global disease affecting about 540 million people worldwide. 1 in every 10 adults now lives with diabetes. Diabetes lowers your quality of life, creates significant impediments, and is one of the leading causes of death. In this video, we will explore the reasons why diabetes develops, the mechanics of it, discover if diabetes is really as incurable as they say it is, and identify ways of helping it. We'll discuss Type 1 diabetes, its causative factors and pathogenesis, Type 2 diabetes and the reasons for this condition, hyper and hypoglycemia, diabetic ketoacidosis and other effects of diabetes, what foods can cause diabetes, refined sugar versus fructose, how to naturally correct this metabolic imbalance, diabetes from the standpoint of energies. The Centers for Disease Control define diabetes as a chronic, long-lasting health condition that affects how your body turns food into energy. We would add that diabetes is a systemic metabolic disorder that leads to profound pathological changes in organs and tissues. According to Google, as of 2018, 34.2 million people, or 10.5% of the US population, had diabetes. Worldwide, diabetes numbers are on the rise.
Type 1 diabetes is an autoimmune condition, as the research shows. It is a self-annihilating process, whereby specific immune cells of our body are destroying beta cells that are also called the isles of Langerhans, found in pancreas and pancreatic ducts that produce our natural insulin. Insulin is a protein-based hormone that is secreted by the beta cells of the pancreas in response to the amount of glucose in the blood. The cause of type 1 is officially considered unknown. We will try to establish some cause and effect connections in order to provide an explanation of the causative factor of diabetes type 1. We say it is not carbs or fats, it is protein that lies at the base of its formation. As already mentioned, the autoimmune nature of the condition is a fact. It stems out an ongoing allergic reaction of the body that occurs in response to the presence of an alien protein within the bloodstream that gets there from the GI tract partially undigested. This protein is a part of dairy product called casein. Proteins are very dense compounds, high molecular, complex polypeptide chains. Human digestion is not designed to break down such complex dense substances, especially when it comes to newly born children and toddlers. Our body can use protein from food only when it is disassembled into amino acids, a basic protein structure. Fragments of protein chains that are not broken down to amino acids are not nutrients, but allergens. Human digestive physiology cannot break animal and other complex proteins down fully. So casein, animal protein, gluten and other lectins turn into allergens, paving the way for a latent inflammation. Once they enter the small intestine, the process of breakdown is over and some little undigested fragments of these polypeptide chains are small enough to be absorbed through the intestinal wall into the bloodstream. There, they will pose a threat to the immune system as an antigen that needs to be immediately destroyed and removed. Protein and its continuous presence in the system will produce the ongoing allergic reaction with later malignization of the process, turning it into an autoimmune condition. The structure of the casein protein and the beta cells of the pancreas are almost identical, and the immunity cells, as they were built to destroy a specific code of protein, begin to view the invaders and their own body cells as one and the same alien substance. As a result, the beta cells are destroyed by our own macrophages, causing the endocrine condition. It does not happen overnight, and people who have it may not know about it for a long period of time, sometimes years before they find out. Let's see how this condition manifests itself.
As beta cell numbers are diminished, the insulin production reduces, and so the ability of the cells to absorb the glucose is reduced too. This leads to an increase of the glucose level in the blood. This glucose in the blood serves no purpose, yet all the cells of the body are starving. High levels of glucose in the blood cause damage of the nerve and connective tissues. High blood glucose level brings harm to the blood vessels. areas of microcirculation are affected the most. Usually it is the distal parts of lower and upper extremities, internal organs, liver, kidneys, heart, microcirculation of the eyes. It gives development to such conditions as diabetic nephropathy, neuropathy, retinopathy. Later effects would cause open and healing wounds, diabetic foot, debilitating and irreversible structural changes in tissues, later necrosis and decay that can quickly spread and cause life-threatening conditions. What you should consider thoroughly in type 1 diabetes is the level of physical activity. Since there is a risk of cellular malnourishment, the individual is at risk of fainting while doing exercises. But when you know how to regulate the blood glucose levels with the proper dose of insulin to adjust to a certain activity level, it is safe. All it takes is find your individual ratio.
Diabetic ketoacidosis. As the blood glucose assimilation becomes impossible, the body begins breaking down fats for energy. This phase is called ketosis. This is when a smell of acetone is noticeable. This condition, if not addressed, would quickly develop into a high acidic ketogenic condition called diabetic ketoacidosis that can put the person into coma and even cause death.
Type 2 diabetes is a chronic metabolic condition based on the inability of a cell to react to insulin that blocks the passage of the glucose inside. This condition is known as insulin resistance. The effect of it is high blood glucose and high fat tissue formation. Unlike type 1 diabetes, this condition is not insulin dependent, but is also caused by inadequate nutrition. Diagnosing it at early stages helps prevent complications. Similarly, it causes high thirst and high appetite. The weight may be increased or reduced. If frequent urination is accompanied by thirst, it is a sure indicator of diabetes. Wound healing is compromised. Ulceration is common, especially in the lower extremities. Eyesight is decreased.
All these are due to compromised microcirculation in those areas. Due to nerve damage, numbness and poor sensation may appear, but these need to be differentiated from magnesium or vitamin B12 deficiency. Medications such as antibiotics or statins may worsen the course of diabetes. The blood glucose in this condition cannot be assimilated because of insulin resistance of the body cells, not because of its absence. Presence of fat tissue reduces the permeability of the cell walls. Therefore, the glucose cannot penetrate into the cells, lingering in the bloodstream. On the other hand, due to long-standing increased insulin in the blood, the receptors are becoming non-responsive to insulin. The common result is that the both type of diabetes, the body cells are starving and are chronically malnourished. This triggers the breakdown of fats and ketones formation, causing high acidity in the spaces between cells, which affects the lymphatic system and reduces its function. All these manifestations badly affect the immune system and create a favorable environment for all sorts of parasites and infections. Let's look at the absorption process of glucose, or sugar as we are used to calling it. Simple sugars are the first-line energy source for all beings on Earth. Simple sugars are absorbed quickly into the bloodstream and provide the energy to most cells of the body. When all energy needs are satisfied, the surplus of glucose will be condensed into a starchy substance called glycogen. We can think of it as sugary water being concentrated into a thick syrup. Now it will be stored in the liver primarily, and some of it will be stored within the muscle tissue for quick and easy access when needed. It eventually turns into fat. This needs to be avoided as high accumulation of glycogen and fats lead to the formation of diabetes. Glycogen can be utilized when we fast or engage in physical activity. Alcohol and medications, on the contrary, may shut down the liver function and prevent the release of glycogen. Inadequate insulin dosage for those who take insulin may cause a rapid drop in the blood glucose levels. For such people, physical activity may also be indicated if they establish the proportionate ratio of insulin dose versus activity level. 200
years ago, an average American ate only 2 pounds of sugar a year. In 1970, we ate 123 pounds of sugar per year. Today, the average American consumes almost 152 pounds of sugar in 1 year. This is equal to 3 pounds or 6 cups of sugar consumed in 1 week. Fruit fructose has different biophysical properties than synthetic sugar and is absorbed differently. But for people with diabetes, even fruit should be avoided until glycogen and fats are exhausted and the condition is remedified.
The increase of glucose in the bloodstream is called hyperglycemia. Hyperglycemia alone, if just diagnosed, cannot be considered diabetes yet. It has to be long-standing hyperglycemia with structural changes and the scope of symptoms that will make up a diagnosis of diabetes. Some of the symptoms may include high thirst, high appetite, low or increased weight, increased urination, weakness, deteriorating eyesight, poor wound healing, numbness in the extremities, quickly aging skin. Diagnosing it in the early stages helps prevent its further development and its harmful effects. However, any of these symptoms may be caused by different factors, and so diagnosis must be established correctly.
The drop in blood sugar level, also called hypoglycemia, in non-diabetic people may be linked to medication intake, liver conditions such as hepatitis or cirrhosis, some kidney conditions, neoplasms and tumors such as insulinoma, a type of gastric cancer, or abnormal high insulin production and some other endocrine conditions.
It is important to timely diagnose diabetes and differentiate it from other conditions that may cause similar manifestations. There are many ways that the modern-day medicine treats diabetes. However, if the nutritional and lifestyle habits are not changed, the disease will not go away and will become more challenging to manage with time. But since it is a metabolic condition, it can only be cured by a correct, adequate nutrition. Adequate nutrition is mindful nutrition that provides essential nutrients, allows for easy waste elimination, can be fully absorbed, leaves no traces of toxins, excludes any food items that create toxic pollution in the body, making the body feel unhealthy.
This means that the following products and product groups need to be eliminated or at least minimized and eaten in proper combinations. Refined synthetic sugar, any refined products, especially gluten-containing grains and flours, overcooked processed unnatural foods, meat and dairy products as they are high molecular animal proteins, potatoes and cooked oils. Since diabetes is an inadequate nutrition disease, it can be corrected within a fairly short amount of time of a few months. Type 1 diabetes, as we know, is not curable. However, if not all B cells are destroyed, and there are cases like that, the condition can still be balanced and the need in supplemental insulin can be reduced, and with the correct nutrition may even be discontinued. This process would require very careful observation by a trained professional. Even the World Health Organization agrees that diabetes can be treated and its consequences avoided or delayed with diet, physical activity.
Changing nutrition would mean introducing more of raw vegetables, vegetable juices, some sour fruit can be added to juice in small amounts, such as lemon, green apple, sour pineapple, good quality dietary fiber, viable vitamins and enzymes, vitamin B12, vitamin D, ionic minerals. Great benefits come from various sprouts and microgreens, such as broccoli, poppy seeds, amaranth, daikon radish. Include green smoothies, avocado and healthy fats like hemp and flax seeds. Water plays a critical role. Liquids other than water, herbal teas and fresh organic juices should not be considered for intake. Switch to drinking pure or reverse osmosis filtered water, or best yet, hydrogen ionized water. Fucus Seaweed Bio-Jelly helps reduce symptoms and the severity of diabetes, as it helps with proper elimination, absorption, balancing hormones, supports all systems and organs, reduces sugar cravings. Complex has additional benefits for diabetes due to the presence of special bioactive compounds that regulate metabolism and break down fats.
the energy realm, diabetes is considered to be a contortion of the stabilizing physical energies. Mostly this is due to mental attachment to food, over-attachment to the physical and material possessions, inability of the body to release toxic matter easily. This is the body type prone to accumulation. Hyposthenic type of physiology is more prone to developing attachments on the mental and physical level. Sweet taste cravings prevail. The past matters more than the present and the future. In Ayurveda, this is the kapha or earth body and mind constitution. It is governed by the energy of the mother, nourishment, sweetness, helpfulness. People of this constitution should be very careful what they eat and strive for balance through adequate physical activity and nutrition. While kapha is more prone to developing type 2 diabetes, pitta, fire, and vata, wind constitution types, are more prone to developing type 1 diabetes. If this was helpful for you, click thumbs up and in the comments let us know what you would like us to talk about next.